What is impotence? If males have the ability to create an erection or maintain it to initiate and continue sex, impotence is considered. Impotence for most men will have anxiety, decreased self-esteem and depression, and in addition to lack of sexual pleasure, it also severely affects the quality of relationships between couples. What is erection? The enlargement and tightening of the penis in men is called erection. In erections, the spongy tissues in the penis are filled with blood and this organ becomes stiff to make it possible to have sex. In order for penile erections to develop, different parts of the body must be synchronized. In order to create an erection and maintain it, coordination between the psyche, brain and central and peripheral nervous system, blood hormones, blood vessels including artery and vein are necessary for entering blood into the penis and not leaving it. When all these devices work together, two large bodies, such as the sponge inside the penis, are filled with blood and the enlargement and stiffness of the penis is created and the erection is successfully performed. During the duration of erections and sex until semen and ejaculation exit, the intravenous valves are closed so the erection continues. After ejaculation, the intravenous valves are opened and the erection ends with the blood coming out of the penis and the penis returns to its original state. It should be noted that in people, erection occurs several times during sleep and in the morning, which is called morning erection or NPT. Causes of erectile dysfunction and impotence include psychological reasons. Sometimes problems of psychological or emotional origin can make a man with impotence and erectile dysfunction. Stress and anxiety can reduce a person's sexual ability for any reason, such as fear of not being able to have sex, fear of the possibility of a partner's pregnancy, fear of disapproval of a sexual partner, feelings of guilt, an early history of repeated ejaculations, homosexual tendencies, sexual deviances, and many other psychological reasons. Vascular and arterial causes. The role of penile arteries in pumping blood and erections is very important. Unfortunately, some diseases such as diabetes, cardiovascular disease and high blood pressure can cause problems in blood pumping and make a person impotent. Aging, obesity, excessive alcohol consumption, smoking, prostate surgery, trauma to the pelvis, hip surgery, pelvic radiation therapy and chemotherapy are also among the things that can cause disorders in the arteries and cause problems with erections. Hormonal disorder. Deficiency of testosterone, pituitary or thyroid hormones and increased prolactin are also some of the things that can lead to impotence. Nerve disorder. Spinal cord amputation and some degree of spinal cord injury are also causes of impotence. Medications. Some medications, such as antipyretic drugs, opioid drugs such as methadone and other drugs such as ketoconazole, spironolactone, alcohol, cimetidine, antidepressants, are among the drugs that cause mild to severe degrees of erectile dysfunction in patients. Erectile dysfunction must have started 3 months ago and gradually in the male. Therefore, a man who complains of erectile dysfunction and impotence and has been suffering from it in recent weeks is fleeting and often recovers without medication. The most common cause of impotence is type 2 diabetes. Type 2 diabetes often goes ahead without a warning sign. A person may notice their illness 5 years after developing diabetes. Erectile dysfunction diseases. Diabetes, heart disease, blood pressure, aging, obesity and high blood lipids, excessive alcohol consumption, thyroid dysfunction, benign after prostate surgery, prostate cancer, blood sex hormone disorder, chronic renal failure, dysfunction of the pituitary gland, hypothalamus in the brain and testicles, neurological diseases Norwegianic, MS, Parkinson's, lesion and spinal cord tumor, trauma to the pelvis, hip surgery, pelvic radiation therapy and chemotherapy, increased blood prolactin, primary testicular failure due to cancer, infection or genetics. Take care of your teeth. Gum disease can cause gingivitis, which can lead to erectile dysfunction. Research has shown that treating gum disease can cure erectile dysfunction. In a 2017 study, men with gum disease who received treatment significantly improved erectile function after 3 months. Morning erection. Most young men experience erections or orchards every few hours during the night, which is a sign of adequate amounts of sex hormones. Tests to determine the reason for erectile dysfunction. Physical examination. Blood testing. Urine testing. Ultrasound. What medicine should we refer to for the treatment of erections? Urologist is the best option for the treatment of non-erection, treatment of erectile laxity and such problems. Urologist or kidney specialist and urinary tract specialist and male infertility, because if the problem is the amount of testosterone, this problem can be solved by medication or injection by the urologist. Treatment of erectile dysfunction and impotence. Lifestyle modification. Things like nutrition, weight adjustment, physical activity and exercise, not using alcohol, cigarettes and drugs, adequate and quality sleep, avoiding exposure to pollution and toxins, can help treat erectile dysfunction and impotence. For the treatment of sexual dysfunctions, being monitored by a psychotherapist is one of the basic principles. In addition, many sexual problems are resolved only by sex therapist interventions. Medication. Some medications, such as sildenafil and tadalafil, increase penile circulation. These drugs are taken orally, but injectable treatments can also be used inside the penis. It is recommended to avoid taking such medications arbitrarily and be sure to take them under the supervision and prescription of a doctor. If the rate of impotence is severe, the specialist will prescribe injections of drugs such as phencylamine, papaverine or alprostadil alone or in combination, directly into the penis. How to use these drugs is that shortly before each sex, they are injected into the penis by the patient themselves. Vacuum. By creating suction and vacuum around the penis, the vacuum device causes blood to enter the penis, and after filling the penis, the pull is placed in the root of the penis, which prevents the blood from draining in the penis. Using vacuum should not take more than 30 minutes as it may damage the skin of the penis. Shockwave. One of the effective methods in erectile dysfunction is the use of shockwave device. Shockwave is a medical treatment that has existed for years. It is often used as a non-invasive treatment option for kidney stones and orthopedic injuries. Recently, this treatment is used to treat erectile dysfunction. Shockwave treatment is usually recommended for patients who do not respond appropriately to medications or do not want more invasive treatments. Prostate massage. Massage therapy is used to treat this disorder. Prostate massage is often used along with other treatments. During prostate massage, the doctor massages the tissues inside and around the groin to increase blood flow to the penis. You may need to get massages several times a week. The duration of the massage depends on the symptoms. Acupuncture. Acupuncture may help treat erectile dysfunction resulting from psychological problems. Studies on its effectiveness are limited. Implant. The use of prosthesis is the latest method of treatment for male impotence and erectile dysfunction and is suitable for those who are not treated with any method and suffer from impotence for a long time. In this method, prosthesis cylinders are placed inside the penis after destruction of tissues. Another way to treat erectile dysfunction is to strengthen the pelvic floor muscle. Try to cut and connect your urine when you're standing. This is also effective in improving prostate enlargement. Implementation method. Tighten the muscle and hold for 5 to 6 seconds. Release the muscle to relax. Do it 10 to 20 times per turn. Repeat exercises 3 to 4 times a day. Do these exercises daily for 3 months. Golden tips. Limit cycling and increase walking and running instead. Less caffeine use. Relax during sex. Take caressing on all parts of the skin seriously and stimulate it. Exercise daily. Use ginseng, mango, shark meat, spicy chili and watermelon.